Hello, good evening. My name is Rada. I'm here to reflect on my interview with Mr. Erickson, a Filipino immigrant who speaks English as a second language. Our conversation gave me a valuable insight in cultural differences, especially in healthcare settings. Let's dive into the 5 clinical decision making questions from Giger and Haddad textbook. The first question asks, what did I learn about this cultural communication pattern? I discovered that Filipino communication is high context and deeply relational. For example, Mr. Erickson explained how indirect language is like I will try instead of no prevents a conflict. Nonverbal cues also matter greatly, like avoiding intense eye contact with authority figures as a sign of respect. This contrasts with the US low context direct approach, where clarity is prioritized over harmony. The second question, what healthcare practices might be influenced by this culture? 2 key themes stood out for me. Family involvement and Haya, Hiya, meaning shame in Philippines. In healthcare, Filipinos may defer to family members to make decisions, unlike the US emphasizes on individual autonomy. Additionally, Haya might delay care. Patients could hide the symptoms to avoid burdening others or to seem disrespectful by questioning the doctors. As a provider, I need to be proactively ask gentle, open-ended questions to uncover unspoken concerns. The third question, what cultural misunderstanding might occur? A major risk is misinterpreting politeness as agreement. For instance, a Filipino patient might nod yes to avoid disagreeing, even if they don't understand the treatment plan. Time perception differences could also cause friction, like assuming a patient is non-compliant if they prioritize the family obligations over strict appointment times. Recognize these gaps as recognizing these gaps can help prevent unfair judgment. The fourth question asks, how can I modify my communication approach? First, I will use the teach back method to confirm understanding without putting the patient on the spot. Second, I will welcome family members into the conversation and provide extra time for decision. Finally, I will avoid overly direct language. Instead of you must do X, I will say, some patients find X helpful. What do you think? This aligns with Filipino values of Kapwa, Kapwa, which is a shared identity, and Pakikisama, I'm sorry if I mispronounced that, which is spelled as Pakikisama, which the meaning means smooth interpersonal relationship. The fifth question was, what was the most surprising discovery? I was struck by the concept of Yuntana loop, a lifelong depth of gratitude. Mr. Erickson shared how this could affect care. For example, a patient might prioritize a doctor's recommendation even if they disagree out of respect. This taught me that the trust building isn't just about medical expertise but also honoring cultural obligations. This interview reminded me that effective healthcare isn't just one size fits all. By combining Ginger and Haddad's framework with active listening, I can better serve diverse patients. Thanks for watching.